A geneticist at McMaster University has written a fascinating memoir detailing her work with rare diseases in children and her own mental health. Dr. Margaret Nowaczyk joins us now with more on Chasing Zebras, a memoir of genetics, mental health, and writing. Good morning to you.
Good morning, Annette. Thank you for having me here.
First of all, let's talk about the title, Chasing Zebras. That kind of means, I guess, going after a more elusive field that you were looking for in genetics.
Well, zebras is a name that we give to very rare diseases, and it comes from something that we are taught very early in medical school, which is when you hear hoofbeats outside the window, think horses, not zebras, because common things are common, and where this adage comes from is probably England, where horses were much more common than zebras, and you are much more likely to have somebody with a pneumonia than something like Wegener's granulomatosis, to name a disease that's strange and unusual. So we are always taught to look for the common conditions, but in genetics, all of the conditions that I look after or try to diagnose and find out about are those rare conditions that you can call zebras. So most of my professional life has been spent diagnosing rare conditions and coming to terms with those rare conditions. So most of my life has been spent chasing medical zebras.
And at the same time, dealing with mental health issues that you weren't really sure. You thought it started in high school, I believe, and you weren't really sure what that episode was like, but it continued on until you almost hit a breaking point.
Yes, well, I did hit a breaking point. I had to take a year off from my medical school education. And at that time, I was diagnosed with clinical depression, and I had to take time off. But that isn't the whole story. And I'm debating with myself here right now whether to tell people about the whole story or to tell them to read the book and find out what the whole story was all about. But
let's read the book, because it is a fascinating story. But you used your mental health issues to kind of better your practice.
In a way I did, yes, because later on in my medical career, I discovered a field called narrative medicine, which as one part of it, and it's a small part of it, it's not all that there is to it, has to do with reflective writing, which is writing about your clinical encounters, your patient encounters in non-medical terms. And as you do that, in with anything in life, whether it's being an engineer or being a scientist or being a policeman, when you come across something very difficult, if you sit down later on in the evening with a pen and paper and write out what your feelings are about that, is very, very helpful, because you can name those feelings, you can articulate them, and then even come up with some strategies and solutions how to deal with them. So that's called reflective writing, which is what got me started in the field of narrative medicine, and has been very, very, very helpful in dealing with my mental health issues and with my very difficult career.
And I can imagine that it's very helpful as well for your patients and for their families, because now the patients with this narrative medicine, they're no longer just test results and measurements. They're an actual patient. They're a person.
Well, I have to say that to me they never were just that, but in some certain fields they have become reduced to numbers and readouts and such. But a physician who practices narrative medicine learns to recognize the story behind the patient, the narrative arc of the patient's life, and knowing that, recognizing that, is able to attend to the patient's needs much, much better, much more in depth and in much more detail, and with a lot more understanding. And at the same time, also take care of himself or herself, the physician, dealing with his or her own emotions about this particular patient encounter, so that they do not interfere with the medical care.
Right. I have to tell you, this is one of the best books I have read in such a long time. Tells about everything you have to go through with medical training, and then everything that you dealt with and how you cared for your patients. So fascinating read. Chasing Zebras, a memoir of genetics, mental health, and writing. Dr. Margaret, thank you for joining us.
Thank you very much for having me.